Hello everyone, my name is Maradiya and today I'll be presenting my summer research project. So for my study I looked at the association between frailty, comorbidity, and overactive bladder in older patients, which include those that are greater than or equal to 65 years of age. So for my study I was interested in looking at whether elderly people with overactive bladder are more likely to be frail and or have more comorbidities. So the hypothesis that I tested is that OAB is associated with frailty and a greater degree of comorbidities, and so it is expected to occur at a higher prevalency in the OAB group than the non-OAB group. So the older population in Canada comprises a significant proportion of the population and is expected to reach 23 to 25% by 2036. So with the rise in the elderly population, conditions associated with the elderly, such as frailty and OAB, is also expected to rise. Studies have found an increasing prevalency of OAB and frailty with age. Other studies have also found that older people with OAB are more likely to have increased numbers of comorbid conditions than those without OAB. So my study aims to look at whether OAB is associated with frailty and comorbidity. For the methods, the inclusion criteria includes anyone who is greater than or equal to 65 years of age, who have attended the clinic between these two dates, who has a diagnosis of urgency urinary incontinence or OAB. Any other diagnosis is placed in the control group. For the exclusion criteria, if they lacked an EFS or a TUGT score, they were not included in the study, if they were diagnosed with mixed incontinence, or if they were diagnosed with OAB post the initial appointment. For the frailty variable, we used two measures. The first measure is the Edmonton Frail Scale, which is a multidimensional frailty index that tests a bunch of things, such as that's indicated on the slide. The score ranges from 0 to 17, and scores of 5 or less was categorized as not frail, while scores of 6 or greater were categorized as frail. The other measure used was the timed up and go test. This is a measure of the patient's physical mobility and the risk of a fall. Times that were greater than 15 seconds to do the task indicated risk. For the comorbidity variable, we used the Charlson Comorbidity Index. This is an estimation of a 10-year mortality risk and has 19 different categories of conditions. The numerical weighting is based upon its severity. Scores were categorized as severe, moderate, mild, or no comorbidities. For the statistical analysis, for continuous variables, we used the Shapiro-Wilk test for normality and then Mann-Whitney-U test. For discrete variables, we used the chi-square test of homogeneity or the Fisher's exact test. So these are our results. Some of the key things I want to point out is that both groups had approximately 75% women and 25% men. The majority of the OAB group was found to be frail as compared to the non-OAB group using the EFS score, and CCI scores were relatively similar. Frailty was found to be statistically significant between groups with OAB and those without, while there was no such association found between OAB and comorbidities. For the discussion, in this study, people with OAB are more likely to be frail and have an impaired TUGT test than older people without OAB. These results are consistent with other studies. I've also found this association. Other studies have found that OAB and urinary urgency appears to result from the central nervous system as well as lower urinary tract pathology, such as white matter disease. And so people with higher levels of white matter disease are more likely to have OAB, impaired mobility, and cognitive impairment. As for the association with OAB and comorbidity, we found no such association in our study, but other studies have reported association in community-dwelling older people. This discrepancy can be due to the nature of the sample in the specialist clinic. The number of older people we had in the control group was small. We only had 45 individuals as compared to the OAB condition, which had 148 individuals. This could perhaps limit our external validity of our conclusions. Thank you for listening. Please don't hesitate to reach out to me if you have any questions.